Ahead and start since it is 11 o'clock now. So thank you for joining us today as the second of our GHBN ECR webinars for 2025. Today's discussion will focus on the intersections between climate change, health, governance, and ethics. My name is Yolandi Rafe, and I'm a GHBN postdoctoral research fellow at the Africa Health Research Institute based in KwaZulu-Natal, South Africa. I will be the chair for this webinar. Joining me is my fellow GHBN ECR, Dr. Han Nguyen, who will be the moderator for this webinar, along with Dina, who is our coordinator for the GHBN. And along with us are our three expert panelists, Dr. Marlies Craig, Dr. Bridget Pratt, and Dr. Remco van der Pas. You're all very welcome. Just a few reminders for the webinar. Please note that the webinar will be recorded. The duration will be about an hour. Each speaker will have about 10 minutes for their presentations, after which we will have a Q&A. Please note down your questions in the chat section of the Q&A so we can get to those. And the duration will be about 20 minutes. And if you like some questions, if there's a question, please like them so that the moderators can prioritize those questions for us. Right. Our topic for today is climate change. Climate change is increasingly recognized as one of the most pressing global challenges of the 21st century. Rising temperatures, shifting weather patterns, and more frequent extreme weather events is increasingly being recognized for the impact it is having on anthropogenic health and well-being. These climate events result in repercussions for future and generations, current and future generations, raising key health challenges related to justice, inequity, and access to care, exposure to diseases, famine, and intergenerational harm. Further ethical questions arise about whether current climate change governance and policy have been adapted to minimize these impacts. In this webinar, we bring together leading experts to examine these climate health nexus through the complementary lenses of policy, science, and ethics. Our first speaker for today will be Dr. Marlies Craig. Dr. Marlies Craig is currently a research associate with the Health Systems and Policy Analyst within the Population Science Department at the Africa Health Research Institute based in South Africa. Her current work focuses on extreme weather events, particularly exploring healthcare delivery, resilience, and mental health. Before joining RE, she worked as a science officer in the United Nations Intergovernmental Panel of Climate Change, the IPCC, Working Group 2 Technical Support Unit, where she supported the science and policy on climate change, health, and vulnerable populations in Africa. Before that, she worked as a scientist for the malaria research program of the South African Medical Research Council. Her work contributed to the creation of a continental atlas of the disease to provide malaria burden estimates and guide national control operations. In 2014, UNESCO showcased it as one of the 11 untold stories of how local communities across Africa are reaping the rewards of innovation. Following Marlies will be Dr. Bridget Pratt. Dr. Bridget Pratt is the Meta Associate Professor in Healthcare Ethics at the Queensland Bioethics Centre at Australian Catholic University. She is also an honorary professor in the School of Population and Global Health at the University of Melbourne. Bridget's research interests include the ethics of global health research and health systems, with a focus on equity, social justice, and ecological justice. During her academic career, she has received multiple distinguished awards and fellowships. From 2013 to 2015, Bridget was a Hecht Levi Fellow at the Johns Hopkins Berman Institute of Bioethics and a Research Fellow in the Department of International Health at Johns Hopkins Bloomberg School of Public Health. She was also a recipient of the Australian Research Council Discovery Early Career Research Awards from 2017 to 2020. Through her current research, Bridget aims to deepen the understanding of how to balance questions of social and ecological justice in relation to healthcare. Lastly, we'll hear from Dr. Remco van der Pas. Dr. Remco van der Pas is the Policy and Research Lead for the Climate Justice and Determinants of Health Work package at the International Institute for Global Health of the United Nations University. He is a public health doctor and an interdisciplinary global health researcher with 20 years of experience in public health practice and international cooperation, global health policy, and academia. His work focuses on health systems and governments, climate change, post-growth economics, and foreign policy. Before joining the UN University, he held research posts in Berlin and the Netherlands, lectured at universities in Antwerp and Maastricht and Science Po, and worked with the NGOs like Doctors of the World and People's Movement. He also practiced medicine and mental health services for refugees and migrants. I will now hand over to Dr. Marlies Craig for our first presentation. Thank you so much for joining us and for sharing all of your expertise with us. I'll stop sharing here and you can join.
Good morning, good afternoon or evening, everybody. We tested this. I hope it works seamlessly. Can you see my slide?
Yes, it's not,
okay.
As we can see it. Thank you so much.
Okay, great. So thank you so much for the introduction. It's really great to be with you today. So we were given some question to speak to, and I will do my best to do that. The first question was, how is climate change currently affecting human health and the social determinants of health? So this is a huge topic. Sometimes I ask myself, in which way does climate change not affect our health? It impacts the world around us and impacts other species and ecosystems, all of which we depend on for our own health and well-being. So health has been called the face of climate change, where it gets personal. I'll try to give a very brief outline, but please also see the chapter 7 on health of the IPCC climate change report for a more complete overview on this subject. Health impacts from climate change really are affecting people in every country. In the 2024 Lancet Countdown report on climate change and health, 10 out of 15 health indicators reached new record-breaking levels, including mortality from heat, life-threatening extreme weather, food insecurity and resulting malnutrition, various infectious diseases, especially vector-borne diseases such as dengue, malaria, and West Nile virus, and of course there are a number of other indicators. Climate change impacts mental health as well in many ways, everything from post-traumatic stress following climate disasters or heat-triggered aggression and violence, to chronic anxiety or depression from devastating losses or displacement, all the way to lifelong developmental deficits from malnutrition or from exposure to heat in early childhood, or even the grief and despair from simply knowing about climate change and losing hope that those in power will do what needs to be done. Evidence in this area is still emerging. One of our projects at the Africa Health Research Institute called WEMA is specifically looking into the mental health impacts in people who have been affected by flooding and drought, including people displaced by the 22 floods in Durban and are still displaced to this day. And then, of course, what can be done about it. So all these impacts on health obviously increase the demand on health systems. But at the same time, climate change is disrupting those very same health systems, damaging infrastructure and supply chains, as well as all the various supporting systems, energy, transport, communication, and so on. At RE, research has shown that the extreme events of whatever nature are linked to treatment interruptions, lower HIV testing, higher HIV prevalence, and poor HIV care outcomes. So these extreme events are via the health system having a big impact on communities. Access to healthcare is one of the determinants of health, but there are others. Access to food, safe water, services, a healthy environment, education, and so on. And yes, climate change affects these too. On top of this, all the losses and damages everywhere reduce livelihoods and economies more generally, and with it budgets to pay for health. So funds that were going to be spent on health now get spent on repairs and recovery. So it's not a pretty picture. The next question, what are the intergenerational impacts of climate change? And this is a particularly important question for Africa, where 63% of the population are under 25. Children suffer from nearly 90% of the disease burden related to climate change. That's a huge number. So really, children are at the epicenter of the health impacts of climate change. For example, among the 1.85 million people affected by cyclones Ida and Kenneth that hit southeastern Africa in 2019, 1 million were children. So, yeah. And the impacts start even before birth. In a recent systematic review, my colleagues and I reported significant heat-related increases in preterm births, stillbirths, congenital anomalies, and 20 other heat-related health outcomes in maternal, fetal, and neonatal health. And then you get long-term, even lifelong physical and mental deficits done by malnutrition during early childhood, and of course the mother during pregnancy and lactations. And these are critical but understudied outcomes of climate change. Every decade, things are getting worse, not better, with fewer options and growing environmental, social, and economic challenges. So annual economic losses from weather-related extreme events have increased 23% from 2010 over the following 13 years. So the younger generation who did not cause the problem will have to face the worst consequences, which then brings us to the next question. What are the ethical challenges, reflections related to climate change and human health? Just like the younger generation will bear the brunt while the older generation caused the problem, so least developed regions bear the brunt of health impacts without actually having caused the problem. The inequality and injustice is really extremely stark. These bloated maps show where extra greenhouse gases are coming from, that's at the top, and at the bottom, where climate-related mortality is concentrated. And you can see that these are two completely different worlds. These are the number of extra deaths from climate change per year projected for 2030 and 2050. The top 5 causes being undernutrition, malaria, heat, diarrhea, and a bit of dengue. You can see that Africa, along with South Asia, carry most of the burden by far. No one would hope that climate funding would go where it is most needed, right? But no, only, to begin with, only 5% of total global climate finance was for adaptation in the 21-22 period. So very little gets spent on coping with the impacts of climate change and recovering from all the losses and damages. And then the share of adaptation spending has even decreased, which is very worrying. Africa received only 20% of this finance, and South Asia only 10%, even though they carry the bulk of the burden, right? Vulnerable and marginalized people get more affected by climate shocks. So climate change makes the poor people poorer and widens existing inequalities. The climate crisis is a case study in moral and economic injustice, according to the United Nations Secretary General. This slide then shows just some of the key current global policies and strategies employed to address the issue of climate health. I can go into more detail later if necessary, but for now, suffice it to say that the World Health Organization plays an important role helping governments to develop their climate health adaptation plans and to strengthen their health systems, to make them more resilient to climate shocks, while also reducing greenhouse gas emissions. These strategies and policies then obviously have to be translated into local action and local context. The Adaptation Action Coalition, for example, is a state-led initiative that then promotes practical actions in health and other sectors like water, infrastructure, and then also locally led adaptation. And it now includes 42 member states. In one of our projects at ARI called Astra, we have adapted one of the WHO tools into the local context and translated it into local language. And it's to reduce the vulnerability of health facilities and improve climate resilience in the face of extreme weather events. I would like to end by returning to the question of intergenerational justice. So out of only 35 out of 103 nationally determined contributions globally would be considered to be child sensitive. So the NDCs is what member governments in the United Nations volunteered to do towards global climate action under the Paris Agreement. The authors of this paper propose 3 priority areas of action to break the vulnerability cycles and to protect children. Firstly, child-centered plans and policies that recognize children as rights bearers and agents of change, financial support for climate action for children, and climate-smart public facilities such as schools and health centers that can continually provide basic services. And I thought this was very worth highlighting. So thank you very much for listening, and back to you, Yolanda.
Thank you so much, Marlies, for sharing all of that information with us. I think that that was really what we wanted to hear and get a better understanding of where we are sitting with climate change at this moment in time, looking at the facts and looking at the findings that we have had. Thank you so much. We will take questions afterwards, but from here we're going to go on to Dr. Bridget Pratt for her presentation to follow. Thank you so much.
You just looking for my slides to share. There we go. Here we go. So I am mostly going to focus on what ethical challenges arise at the intersection of climate and health. And for me, the ethical challenges typically arise at the intersection of social justice, environmental justice, and ecological justice. And I just want to quickly go through what I mean about these different axes of justice. So social justice is generally about what is owed to humans. And here I'm going to assume a global scope of justice, so humans everywhere worldwide. And this is generally what is owed to humans without considering the environment. So humans are owed a certain level of health and well-being. They're owed respect and protection of cultural difference and diversity. They're owed efforts to reduce unfair power relations. They're owed a number of different goods according to social justice theory. Climate justice thinks about what do we owe people in relation to the climate. And this is very much about reducing disparate risks between people in terms of the effects of climate change being very uneven, as we just heard in the previous presentation. And so this is really what is owed to current and future generations globally in relation to the climate. Environmental justice goes more broad. So it's really about what environmental conditions broadly are owed to current and future people globally. So it's not just about the climate. We're also thinking a bit more broadly and in terms of, for example, other planetary boundaries like biodiversity and I guess land system change, for example, if you're thinking in the planetary boundaries framework. And then ecological justice is what do humans owe to nature. So the first 3 are all very anthropocentric. They're about what do humans get? And the last one is more what do we owe nature and assumes that nature has intrinsic value. And so one of, I guess, in thinking about, what big ethical challenges are we facing in terms of climate and health, I think one of the big ones that the philosopher Elizabeth Cripps talked about in one of her papers was She says to do basic intergenerational environmental justice, greenhouse gas emissions must be curbed, natural resources preserved, and adaptation mechanisms developed until future generations are left with the opportunity for a universal, decent human life. To achieve basic global justice, this must be done without leaving anyone in this generation avoidably without this opportunity. Ultimately, the two ends could become incompatible. So I think one of the big ethical challenges is when securing basic justice for our generation becomes incompatible with securing it for future generations, not just in the near future, but also in the distant future. And this is one where if you read intergenerational justice philosophy, it's the one that I feel like gets sidestepped. You have philosophers saying, well, you know, we owe a sufficient level of health and well-being. We owe a decent life to current generations. And yes, we also owe that to future generations. And they kind of stop there. They might actually say, oh, but those might come into conflict, but then they don't actually say anything about, what do you do if they come into conflict? So I feel like in terms of the ethical and philosophical resources that we have, that question doesn't really get answered very well, if at all, in current theory. And it also does raise the question, are we at that point yet? And this isn't the only type of literature you can draw on to answer that question, but the planetary health literature, and specifically the Earth systems justice literature, does try to start to answer that question of, are we at that point? And so the Earth systems justice literature develops a conception of justice that tries to bring the different axes together. And it says essentially that as a matter of justice, we need to achieve certain social ends and we need to achieve certain environmental ends at the same time. And so they take very specific positions on what the social ends are and what the environmental ends are. And those, can be debated whether they've come up with the right ones, or not the right ones, but just there are a lot of options beyond what they have selected. So in terms of the environmental conditions that are owed, they link their conception to the planetary boundaries framework. So on the environmental side, we should be operating within the planetary boundaries. And then on the social side, people should have enough resources for a life of dignity where they have escaped poverty. So that to me is essentially a basic level of justice, escaping poverty, because that's kind of I would say the lower threshold end. A decent life goes a bit above that to the level of life or quality of life that you can achieve in countries like Australia, where I live. So they've come up with this conception, but then they've also started to measure, can we achieve both of these social and environmental ends at the same time? And what their work is showing is that right now, if we wanted to achieve basic social justice for everybody worldwide, we would overshoot the planetary boundaries. And on the flip side, if we try to operate within the planetary boundaries as like we're currently going, we wouldn't be able to achieve basic social justice for everybody. So essentially it does suggest that we could be at a tipping point, but then we still have room for what they call just transformations, so that societies can actually transform themselves in ways that then enable us to meet both the social and the environmental boundaries at the same time. And so going back to the original big ethical challenge, are we there yet? Their answer would be no, we just have to transform our societies. And I think this is where additional ethical challenges come up in terms of transitioning to a more environmentally friendly way of living. And I look at this mostly in the healthcare context. So the context of shifting to more environmentally sustainable healthcare and that transformation. and what sorts of conflicts come up between health justice and social justice on the one hand, and then environmental justice and ecological justice on the other hand. And I'll finish up with just a few ethical challenges that are arising as healthcare starts to transition in a number of countries. And this slide is just to explain why healthcare is bothering to transition. It has a rather large environmental footprint in terms of greenhouse gas emissions. It produces a ton of waste. Single-use products are used a lot in healthcare. It also produces a lot of toxic waste and chemical pollution, air pollution, and there are studies now showing impacts on biodiversity and land use as well. So healthcare has a large environmental footprint, and there's huge momentum behind shifting healthcare to become more environmentally sustainable. But at the same time, that transition is raising ethical challenges and conflicts. So these are just some conflicts that are rising. It's not an exhaustive list. These are just ones that have actually come up already in some of the work that I've done or that other people have done. So in terms of resource allocation, so green design, this is around changing how the built environment of healthcare is set up. And so there's a push because I mean, the numbers vary by country, but in Australia, I think about 20% of the carbon emissions from healthcare come from the built environment. So there's a push in healthcare to design green buildings, and these cost more. So, and especially, so different countries have different green building frameworks. They generally have tiers. So in Australia, we have Green Star, and there's like a 4-star, a 5-star, and a 6-star level. And building a 6-star hospital is really expensive. And so this is just from some research that I have done, and this is a quote from somebody I interviewed. And they're saying that, I think some costs for things to be super, super green and everything, it's probably just not affordable. In an ideal world, you would probably have it as green as possible and be doing everything that has the least impact on the environment. Then that comes at a cost, and that takes it from a bucket of money that could be used for people in the hospital. So essentially, the dilemma here is, do we spend lots of the healthcare budget on a new green building, or do we allocate that money to delivering effective healthcare to patients who need it? And so that's really a tension between social justice, which is equal access to high quality healthcare, versus actually environmental and ecological justice, on the other hand, which is minimizing healthcare's environmental impacts. In terms of another example, in terms of clinical care delivery, this example is around asthma inhalers. Meter dose inhalers produce quite a large, well, I think it's about 3%, but it does end up being a large proportion of healthcare's impacts. So asthma inhalers, they're widely used, and anybody with asthma finds them incredibly necessary. But as I said, the most often used type of asthma inhaler has a large carbon footprint. There is alternatives that are lower carbon, but they cost more. And so this is a question around, should we deliver equally effective care that costs more for environmental reasons or not? And it again is a resource allocation question, because the money that it takes to pay for lower carbon asthma inhalers could be spent somewhere else on delivering healthcare to patients. So it's a similar type of dilemma, but in the context of clinical care delivery rather than the built environment. And then this last one is an example of the question around, should we deliver less effective healthcare to patients for environmental reasons? And this is something a few years ago in Australia and anesthesia, there was this report that said, well, nitrous oxide has a really big impact on the environment. It traps more heat in the atmosphere than carbon dioxide. And essentially, they found that I think the emissions from somebody having a baby, if you use nitrous oxide, that's like the equivalent of driving 1,500 kilometers, whereas an epidural is the equivalent of driving 6 kilometers. So the report proposed that, perhaps pregnant women should forego nitrous oxide and either have a natural birth or use other types of pain management during labor and delivery. And this headline is just the opinion of a woman in response to that suggestion that women should have to have less effective pain management for environmental reasons. And I mean, this one hasn't actually been implemented, but it was a recommendation. And yeah, it's an example of just a suggestion, that people should have less effective healthcare because of the environmental footprint of delivering that care. So I'll leave it there. These are just some examples and food for thought and discussion later on. So thank you.
Thank you so much. That was excellent insight. I think many of us on this webinar have learned a few things and have got some questions to follow up here. Thank you so much for sharing your expertise here with us. Next up will be Dr. Remco van der Pas.
Yeah, thank you. Wonderful. Wonderful to be here. I didn't prepare slides. I just wanted to build on the discussion that was already provided. And this is really about the trade-offs in our healthcare system vis-a-vis the impact of the climate crisis and how we anticipate it in vis-a-vis a just transition. Well, just to say, I'm calling in from Kuala Lumpur at the United Nations University. We really not doing the empirical research ourselves, but really see what we can do with our partners and with actors to transit, including with governments and within the UN system. So for me, the question is how to ensure what is enabling transition and what is hindering it. So all the research that we are doing, what is possible to enable change? What's our theory of change in dealing with the polycrisis we're in? And while working on this, and we work in different work streams, so not only about climate justice, but also about power and accountability issues in global health in general, and gender justice issues, and digital health security questions. So we take a very decolonial, intersectional kind of approach to our work in dealing with inequities. So from that angle, my entry point to this debate is, okay, so we need to transform. We have the ethical challenge, but what blocks us? And what blocks us is really the economic system that we're currently still pursuing and that we have pursued over the last decades. So in my work, I start to engage much more with the ecological economics debate about transition and what kind of development perspective do we pursue? What kind of economies do we see ourselves in ensuring the good life, in overcoming the challenges that we're having? And this is not at all new. There have a lot of economists have been looking into appropriate models for pursuing certain values, both social as industrial as well as ecological, but we cannot disconnect ourselves from these economic systems. And I think this is my main message from today. We need to engage with economic thinking as bioethicists and as health professionals. Ecological economists have been doing that in relation to the limits to growth, thinking from the 70s, from the Club of Rome, the limits to growth model, which is in essence a scenario-based model where there were some basic indicators imputed in the first computer model, said, look, if you think about it, we cannot continue with the growth model as it is because we will extract our resources. There will not be the physical resources possible to sustain growth and food security and population growth as it is now. And at one moment it will implode. They call this the problematiek. It's the externalities from a modern development model. And we have pushed the can forward quite long. We kicked it forward. But actually, these models say, well, we're reaching this point relatively soon. We might have peak oil, and we might also overstretch other rare earth minerals, etc. And this belief in the technological innovation to deal with our problems is not so warranted as many of politicians, but also scientists led us to believe, including in the healthcare sector, I would say. So there's, from an economics perspective, there's people working on well-being economies, on donut economies, on post-growth economic thinking. And for me, it's interesting to see how we in the healthcare sector and from a public health perspective relate to that. There's now just Bridget was referring to the planetary boundaries, and they do now a planetary health boundary check. There's an update from the Stockholm Resilience Center. We now have overshot from a global perspective 7 out of 9 boundaries, while in many countries the essentials from a human security perspective, from a development perspective, are not met. So we see inequities growing. And for me, this implies that in many, let's say, and there's models also about it, that in lower income countries, we need to use the carbon budget that is still there and to do the social investments to reach those foundations and essential human rights vis-a-vis education, food security, healthcare. But it can only work to an extent that we remain within the planetary boundaries, or and basically return to those in places where they are completely overshot, like in the US and in European countries, and in most of the middle income economies at the moment as well. So it means it's a kind of, if you think about it, it's a post-sustainable development model thinking, whereby we actually really need to think, so how can we move our economies in thinking beyond gross domestic product, beyond growth, and growth from a GDP perspective is expanding consumption and production, but from a limits perspective, we need to carefully consider that that there will be hard physical limits to what we can actually grow in the coming decades ahead, which means that the consumption of, even if it's related to rare earth materials that are used now also in lithium batteries for e-vehicles or solar cell energy, that is available, but at the same time it comes with a high cost. And is it indeed, as was said before, not better to invest it in the basic capabilities and in the health promotion that nurtures human and ecological well-being? So this is to say that from in the post-growth world, they talk a lot about, okay, we need to restore biocapacity. We really need to think about talking about fossil fuel non-proliferation and to reserve 30% of our planet for biodiversity reduction. We need to really think about how to distribute this in a fair way. What is, if we really want to invest in both planetary and human well-being, we need to have a big taxation shift. We need to cancel debts. We need to make sure that there is a incredible carbon tax to invest in the basics that that people would need to have social protection and to ensure that they're skilled and trained to engage in this new economy. We need to think about basic income schemes so that people have the financial needs to and security to actually have the social innovation to not work in sweatshops or in the warehouses of Amazon to the profit of a few that benefit from those activities. And we need to have a kind of a democratic bottom-up transition of engaging citizens and healthcare professionals in doing things that matters. It's the whole democratization and deliberative practices, which are so much under pressure now in many countries, including in the global north, so to say. So these packages, so this economic shift thinking, Karl Polanyi in the 40s called it the Great Transformation. That thinking is really not yet present in healthcare. In healthcare and public health work, we talk a lot about responsiveness, preparedness, universal health coverage, expanding healthcare and investment, but these communities are not really connecting. And that's what we aim to do here at IHH. It's a sentiment that healthcare as it is now should not only be resilient, it should also transform. We need to think about how our healthcare systems would look like in the next 15 years, very contextual bound, and that healthcare cannot rely anymore on high energetic, high resource intense ways of addressing healthcare problems at the end of life, which means also with the diagnostics and the medical interventions that do provide value, but are quite individualistic and from a life year expectancy quite limited. But we need to have a real shift towards health promotion, essential primary health care, ensuring that basic essential medicines and provisions are being met. But there's a lot of conflicts of interests there, and because healthcare is very much also captured by commercial interests. It's one of the fastest growing economies in the world. In most of the countries, healthcare, health services sector grows 2-3 times as fast as GDP. And I think this is where the challenge comes in. That those that at the moment that invest in healthcare and the public-private partnerships, they're focused on quick gains, on rather individual treatment-oriented, biomedical-oriented options, while from a planetary health perspective and from an ecological, economic and justice perspective, we should focus much more on the promotion and the broad population health directions, which are not new. This is basically Ottawa Health Charter thinking. This is Alma Ata primary healthcare interventions, and a lot of things should not follow. A lot of those investments should not directly take place in healthcare itself, but rather intersectorally in those sectors that have a large impact on health. Education, the nutrition, urban development spaces, etc. And I think this, for me, this is where the sweet spot comes in. And I will be eager to hear from this community how you see the bioethicist community contributing to that debate. And I will leave it with here, and I'm looking forward to continue this discussion. Over.
Thank you so much, Dr. van der Pas, for that. I think that take, bringing in that economical perspective, I think is so necessary for this dialogue, really, as it comes down to that. We're going to move on to some of our questions. I think there were a few in the chat. I think we have our first question was from Dina. That says that comes to mind, one question comes to mind is whether the ethical considerations are included, or rather to what extent are bioethicist principles included in these global health policies and strategies. I don't know, Dina, if it's aimed at someone or just at the general discussion.
That was aimed at Marlies when she was talking about the big global health strategies that exist. I was just curious on whether they include any sort of bioethics underpinnings or principles.
Yeah, so as far as I know, not really specifically bioethics, but more broader distributional questions and questions around justice and things like that. And I think in the language even of the Paris Agreement, it's there. So I just looked up the exact wording. You know, it's reflecting equity and the principles of common but differentiated responsibilities and respective capacities in the light of different national circumstances. So it acknowledges the different contribution to climate change and the different capacity to respond. And there's, you know, there's always that sort of, in the policies, there's intention of taking account of that, but that then has to translate into practice. And when we look at, you know, the actual numbers of where climate finance is going and where, you know, if it almost seems that the intention, the acknowledgement is there because you can't ignore it. But in practice, it doesn't always work out. So in the health policies, there's the same, really an acknowledgement of the different levels of contribution to the problem and the different burdens of the impacts. And there's a lot of focus on least developed regions or low-income countries to strengthen health systems and so on. But it really, it always depends on the action, right? Does that translate into action?
Thank you.
Thank you so much. I think probably there is where we are sitting, asking whether, and I think we did ask at some point a question about whether these policies and economic interventions are truly relating or translating into transformative practices and what those practices might be in particular. We have another question. It's probably a very big question. I don't know if you'd like to ask the question yourself, but it says here, how and why does climate change need bioethics? So justice considerations, such as social intergeneration and so forth, are not exclusive to bioethics. Likewise, adding health considerations does not by itself transform climate change into bioethics. Moreover, does addressing climate change require bioethicists to rethink and reconfigure their professional identity? That's quite a tough question. But maybe we can think through that. Considering the number of ethical issues that have been raised through the presentations, my view would be that yes, the bioethicist needs to be there. But let's hear from our experts. I don't know who would like to attempt that one.
I can just share an example. So I've just been doing some empirical research with a hospital network in Australia, and we we're interested in when you're building a new hospital to be environmentally friendly, when does that come into tension with delivering healthcare to patients? And we spoke to the
Sorry, Bridget, just to interrupt you. Sorry, we can't hear you clearly. I don't know.
Oh, sorry.
Maybe thank you.
Is that any better?
No,
Yeah,
we can
sorry,
hear
the
you.
internet's a little unstable, I think. So we were interested in asking the project team who was building this new hospital. So that includes, people who are working for the hospital network. It includes the architects, the engineers, and all the different staff involved. And essentially, when we interviewed most of them, they would just say at the start of the interview, oh no, there are no trade-offs, there are no conflicts here. Health and the environment are synergistic. Things that are good for the environment are good for people's health. And it was through the interview process. So by the end of the interview, pretty much everybody was starting to identify tensions, but it was only through that reflective process that they ended up getting there and noticing that there were tensions to begin with. And the exception here was the architects and the engineers, because they have to think across health and the environment all the time. And so when you ask them, are there any tensions or trade-offs? They were like, sure, let me tell you what they are. It's easy. So I think a lot of people, at least in the healthcare space, don't necessarily notice the tensions a lot of the time. And there's a role, I think, for ethics to come in and be helpful there, because not just identifying tensions, but what's at stake in those tensions. I mean, I can tell you all the different dimensions of social justice, ecological justice, environmental justice. Like I can look at a conflict and tell you what goods are at stake in a way that people working in healthcare probably wouldn't necessarily do. So I think there's a role for ethics to be there to help people be reflective, and when they are reflective, to provide guidance on how to kind of analyze what's at stake here, and then also to provide guidance on what you should do, because that's a normative question, and that's the realm of philosophy and ethics. It's not what happens on the ground. What isn't necessarily what ought to be. So I think that distinction is something that ethics brings to the table to draw out what should happen. That's just my 2 cents as an ethicist. I'm very open to hearing what other people think.
Thank you. I don't know who would like to say it, but I do agree with you. I think it is quite important, like you mentioned, bringing the different or diverse perspectives to reflect robustly on a topic, I think, is so essential to help us to further our understanding and where we sit and what solutions could possibly be the best. And they can sometimes come from very unexpected places. So the ethical perspective, I think, is really important. And like you mentioned, that normative framing of what we should be doing, I think ties in a bit with what Remco has said in terms of rethinking our economic strategies around this. I don't know if Marlies, if you want to add to that.
Yeah, I mean, one thought that came up when you were giving your examples from the hospital and mentioning that bucket of resources, I think that is part of the problem, is that our society is kind of in these buckets, and that we think of health as having a limited budget, but we don't look outside of health and ask, like, how much money is there actually? I mean, to cite some numbers, in 2022, the total subsidies to fossil fuels was 1.4 trillion. And one of the recommendations of the Lancet report, for example, is some of the indicators are looking at how much divestment is happening from fossil fuels and how much of that money is going into health. So it's not as if there's no money, it's just being spent in the wrong way. So the question isn't, should we take away from birthing mothers so that to protect the environment? It's like, where is the money? And it's being wasted on fossil fuels that are causing the problem. So also this, for me, it's a huge, the whole idea that the health system, the global health system is producing, what was it, like 5% of the total global greenhouse gas emissions. That is more than all of Africa. So Africa contributes about 3 to 4% of global emissions. So how much of the African footprint is by the African health system? So you see those numbers just point to incredible imbalances in even the way we're thinking about it. To think that the African health systems should even consider their carbon footprint, to me, makes no sense, because it's like 5% of 5% of, you know, and so many people are not even having their basic health taken care of. People are dying of perfectly preventable diseases. Hundreds of thousands of children are dying, you know. So, and then also, you know, looking at solutions, there was an interesting article in Nature where they modeled an entire renewable energy grid system that spans the continent of Africa, that is viable and sustainable, using all the renewables, not fossil, for as little as just around $300 billion. And it's little because Africa's debt repayments alone are 160 billion per year. So all you need to do kind of is for 2 years, scrap the repayments, and you can build this continent-wide energy system. And even if you think, I mean, renewable energy has its own benefits, you know, because it can be local, and, you know, you're not dependent on all these big international corporates. But even if with fossil fuels, if you gave everybody in Africa who doesn't have household electricity, if you gave them household electricity, it would only increase global energy demand by 0.2%. So don't people deserve that? And shouldn't we rather take it away somewhere else if we can't afford that 0.2% of a carbon footprint, you know? So I think in this whole debate, it's easy to get stuck. And I think you know, the people with vested interests are very happy if we get caught up in small debates, because we miss the big debates, we miss the big amounts of money that are going around, and we're missing the big opportunities of shifting from one sector to the other. So yeah, anyway, those are just some of the thoughts that came up while, in the discussion.
Well, thank you so much for that. I think you do raise some very important points about, I think, where the funding is going, and again, rethinking our strategies around that, and what it would mean if we, you know, one of the ethical dilemmas is to perhaps, you know, disadvantage those who are already disadvantaged in order for those who are sitting in the benefits of industrialization, and to further benefit them to the harm of those. We are sort of at the hour, so we're going to have to wrap up. There was an additional question about children, hearing the voices of the children. I think another issue for us to think about, and perhaps this is something to explore later on, is this introduction of AI into our world, both in healthcare systems, and what is that going to do with the economy as well, just to add to this. But other than that, I think we are at the hour. I don't know if anybody has any further comments, final remarks that you want to share with us before we close out. Right, then I'm just going to say thank you to our speakers and to our audience for joining us today. We hope you found this webinar as informative and thought-provoking as we did. This is just a reminder that the recordings will be available on the GHBN YouTube channel and the website in a couple of weeks' time. And please do follow us on LinkedIn, the GHBN, and to stay informed of upcoming announcements and future webinars. We thank our speakers very much for your time today, and to all of you, for the audience, for participating. So on behalf of myself, Ha, and our fellow ECRs at the GHBN, we wish you well until next time. Take care.
Thanks very much, everyone, and goodbye.
Bye-bye.
Thanks. Bye, everyone.